So last weekend, we had some healthcare statistics quietly released with little fanfare. You know, when they drop it on the weekend, they're not really looking for people to pay much attention to it. And today, legacy media, of course, has already forgotten those statistics. And it's a pity because the dramatic improvement in waiting times for ambulances due to new policies implemented by the UCP should be making headlines right now. As recently as last fall, Albertans were dying, literally dying while waiting for ambulance services. One of the worst cases was an elderly woman who bled out after a dog attack just minutes away from Calgary's largest hospital. She had to wait 40 minutes for an ambulance to arrive. We had red alert periods in Calgary and Edmonton where there were no ambulances available at all. It was commonplace. Meanwhile, rural ambulances would get pulled into urban centers, and then rural firefighters and police officers had to take on paramedic roles as they desperately tried to transport injured people to hospitals. Now, paramedics and citizens have been raising concerns about this issue for years. We've had multiple governments paying lip service to the problem, but none have done really anything aside from tossing more money at the issue, and it didn't have much effect. Until now. Danielle Smith raised the EMS crisis as an issue while running for the UCP leadership, and she promised to act upon it when she became premier. Well, last December, the Smith government announced changes that were going to be made to improve EMS response times. To begin with, vans were going to be equipped and contracted for use in non-emergency transfers of patients. Ambulances and trained paramedic teams have been doing that for up to 75 trips a day when they weren't really in need of emergency services, these transports. Meanwhile, of course, emergencies are happening. The NDP predictably responded with hysterics and accused Smith of wanting to harm patients by using Ubers instead of ambulances. In those cases, despite the hyperbole from the NDP, Uber actually is often a more appropriate option than a fully equipped ambulance for a non-emergency patient transfer. Smith also vowed to increase physicians, nurses, and other resources for triage in emergency rooms to reduce the time paramedics are stuck doing hallway care because the hospitals weren't admitting the patients being dropped off. And we've had at times as many as 20 ambulances piled up outside of hospitals as paramedics can't find hospital staff willing to take the patients. NDP health critic David Shepherd panned the plan, saying, "I can't see this announcement being anything but an incredible disappointment to Alberta's paramedics and frontline healthcare workers." The UCP government also started to set timelines for emergency rooms to take patients. Then again, the NDP accused the government of forcing paramedics to dump and run with patients, which was utterly untrue. Hospitals were expected to admit patients from ambulances in less than 40 minutes. That's not an unreasonable request. So now it's been a few months, and the numbers are in, and they look fantastic. In November of 2022, so just last November, Calgary was in a state of EMS red alert for 4.2 hours. In 1 month, 4.2 hours, the city of Calgary, 1.4 million people, had no ambulances. Last April, that number was down to 4 minutes. 4 minutes, that was it. That's quite a reduction. Ambulance response times last November, they averaged 22 minutes in urban areas and 64 minutes in rural zones. That's a pretty long time if you're in serious condition. Well, last April, those response times had dropped to 12 minutes in urban areas and 40 in rural areas. This is life-saving, folks. And the silence on this success is deafening. There's no doubt about this. Lives are going to be saved thanks to the changes made by the UCP to EMS policies. We should be shouting this from the rooftops and examining more common sense approaches to healthcare bottlenecks in the system. Unfortunately, partisan loathing of Danielle Smith has rendered the establishment and legacy media outlets incapable of crediting Smith with doing something right. The bloated Alberta Health Services bureaucracy has created an inefficient healthcare system incapable of embracing change or innovation in care. And in firing the inept board of the health services and forcing common sense solutions to the problems, Smith's actually managed to bring about quick success with a crisis that hadn't seen improvement in over a decade. Now Smith is taking a strong, no-nonsense approach with taking on the addiction epidemic as well. She's surrounding herself with treatment specialists and recovered addicts rather than listening to the usual suspects in the establishment who insist on further enablement policies. Enablement policies for addicts have failed, and they're failing throughout North America. Overdoses are continuing to climb while the number of addicted people keeps growing. We need results-based policy rather than aspirational ideological pap. Smith seems to be willing to cut through the BS and impose policies that work rather than pursuing policies that feel good. If Smith loses the election due to an establishment that refuses to accept positive changes, the healthcare system and the addicts in need of treatment will all suffer for it. If we can't credit a success, we're never going to see more of it.